Okay, so I've been asked to debate this one, so this is going to be a good one. So children are just little adults, right? So people think that, oh, well, you know what, a little ballerina here is a big ballerina there, a little policeman guy over there is the same as a big policeman. Just to plug, we have a growth study, so this little duck over here is the same as this little duck over here. So I'm going to say that children are just little adults. Okay. So again, these are some people that I know. This was my dad. Now he was like that, and this is my son, and now he graduated. And they're really the same people. They haven't changed their names. They still have the same mother and father, so they're not really any different than who they were. Natural history, what do we see? Well, in pediatric or adult, we know that there is a difference, that the colon's most often involved in pediatrics and that in the adult, but it's still the GI tract, isn't it? And that disease progression in the first decade of life tends to be more aggressive, but you know, having that disease extension is less common as far as the adult side. In ulcerative colitis, we know that the pediatric onset is more likely to be pancolonic, and that, you know, again for adults it's on the left side, but it's still in the colon, isn't it? And that shorter time for diagnosis, okay, kids run faster than adults, don't they? So isn't it the same thing? So aren't they all alike? What about medications? Oh, peds, we use steroids. Adults, they use steroids. Should be the same. Mesalamines, yeah, we use it. So do the adults. Immunomodulators, yeah, we use that too. So do the adults. Biologics, sure. So aren't we all the same? What about extraintestinal manifestations? This is pretty short, I promise. Dermatologic, so we're going to learn a little bit about that. Yeah, kids get rashes. They can have issues with their medications, so do adults. Ophthalmology, well, we know that uveitis, episcleritis, issues with glaucoma, that happens with peds, happens with adults. Bone health, sure. Adults have fractures. Children on steroids, well, they have poor low bone density, but, you know, it's still the bones. Vaccination status, well, in pediatrics, isn't that part of what we do? We make sure that they have all their vaccinations. We want to make sure they are immune to Hep A, to Hep B. We want to know what their varicella status is, EBV. You know, kids have less EBV exposure when they as they go on through life. They are exposed, so same thing. Papilloma, so Gardasil, sure. Kids have the risk, so do adults. Flu vaccine, yeah, we think they should get that too, so aren't they the same? Reproductive health, well, we're not quite there for peds, but you know, we have kids that are going through puberty and we want to make sure that they're doing okay, but it's the same thing, isn't it? What about mental health? No, kids never get depressed, they never get anxious. It's got to be the parents. But the adults do. All right, we have that same thing. Extraluminal disease, do we really see that in pediatrics? Do we ever see PSC? Do we ever see problems with medications and you wind up having some liver issues? Occasionally, stones. Do we see that in peds? Occasionally, so it's just like adults. Pulmonary, occasionally you can have issues. We certainly know that not only medications can sometimes cause this, but you actually can get Crohn's in the lungs, and we can sometimes see that in peds. So aren't we all the same? And what about dental health? Well, that's a major focus that we're beginning to have now, that we think that the oral health has an impact on what's going on in the GI tract, but children have mouths, so do adults. Aren't we all the same? That's going to be my answer, but I've got to argue the other way.